Now we want to bring in Dr. Thomas Frieden. He was the director of the CDC during the Obama administration and is now the president and CEO of Resolve to Save Lives. That's a global health initiative. Dr. Frieden, thank you so much for joining us on this really important morning. We want to get your perspective on how important it was, the decision to move President Trump to Walter Reed. How important will that be to his recovery, do you think?
Well, there's no doubt that was the responsible thing to do. We all wish the president and his family well and for a speedy and full recovery. The fact that he received the monoclonal antibody cocktail yesterday, it's an experimental treatment, but it's a very promising one, particularly when given early in the course of disease. It was probably expected that he would receive remdesivir as well. Remdesivir, there's some evidence, will delay or shorten the duration of illness and may improve outcomes. Because the president is 74 and because of his weight, he is in an increased risk category. But really, even at that age, even with the weight issue that he's got, there's an 85–90% likelihood that he'll be just fine through this. So we're all hoping for that.
Certainly that's the case, Dr. Frieden. Just Thursday night, President Trump had pre-recorded a message where he said the end of the pandemic is in sight. Of course, we are seeing cases on the rise in parts of this country right now, Wisconsin and some other states reporting that. Where are we in this fight right now?
Well, we're still right in the middle of the pandemic. Anytime you turn your back on this virus, it's going to come back to attack. And that's what's happening in much of the country. We're seeing openings in the context of high and, in some cases, increasing case counts. We're still seeing at least 500 to 1,000 deaths every day. That's an almost unfathomable number. And here in New York City, where I live and work, we're seeing a very concerning expanding cluster in many communities. So we're not through this pandemic. But the striking thing is there is a lot that we can do to chip away at the risk. Masks, distance, hand washing, closing indoor spaces that result in a lot of spread. These make a big difference.
Yeah. Dr. Frieden, quickly, a lot of Americans obviously pinning their hopes on a vaccine. They think that that is going to be the return to life as normal. What is your expectation once there is a vaccine?
We're hopeful, guardedly optimistic there will be a safe and effective vaccine, but that's not proven yet. And when it does come, it's not going to be a fairy tale ending to this pandemic. It's going to be rolled out gradually. It's not going to be perfect. And we're still going to have to adapt a lot of aspects of our lives so that we can be as safe and as productive as possible as a society. But a vaccine is the single most important tool, and that's why it's so important. There are no corners cut on safety so that people can know that not only is it safe and effective, but that it can be trusted.
All right, Dr. Frieden, so great to have your perspective this morning. Thank you.